Through this issue of JAVMA, May 2014, we are going to tackle this article, Animal Behavior Case of the Month. These are cool cases. I don't get too many of these from these journals, and behavior issues are very common. I do have other behavior videos on this channel if you want to search behavior. They're focused mostly on dogs. And then just a quick plug for abidog.com/VT. This is the vet triage specific page for Abidog, which is a behaviorist consultation service. It does work with artificial intelligence. It's incredibly thorough, very detailed, and you can share the results with either vet triage doctors once you have this completed, or you can share it with your family veterinarian. Dr. Dennis here is a board-certified behaviorist out of Australia. I've met him several times in person and on Zoom. He's awesome. So this is a fantastic novel site for those who have behavior issues with their dogs. It is dog-specific at this point, but make sure you go ahead and make the most out of that. Okay, statement of the problem. A dog was evaluated because of repetitive motor behavior, spinning, and destructive behavior, scratching at the door and doorways in response to the owners leaving the house. 9-year-old female spayed mixed breed dog. The history. This dog was adopted at 9 months old. She had bilateral epidermal crust in the dog's hip regions, which resolved on its own upon adoption. The owners observed the dog's hip regions were wet after several times, during which it had been left alone. Videos obtained during the absence of the owners indicated the dog spun in circles, snapped at the caudal aspect of its body, thereby depositing saliva on the hip regions. 7 years later, the dog wounded the tip of the tail when it was left alone. The dog had been treated with a benzodiazepine called alprazolam for several months. 3 weeks prior to the behavior consultation, the dog damaged a door and doorway when it was left alone. The dog then barked and spun in tight circles, 10 spins, snapping at its hip every spin. And this study comes out of the vet school in Atlanta, Georgia. The owners never witnessed the dog spinning in their presence. Physical examination was pretty much normal. Radiographs of the hips were recommended but declined by the owners. Blood work was normal. Diagnosis is spinning. Can occur because of medical problems, attention-seeking behavior, or a compulsive disorder. It can also be a conflict or fear-induced stereotypical motor behavior. Because the behavior problem of the dog in this report occurred only in a specific context, meaning when the owners were gone, medical causes were considered unlikely. True hyperkinesis was also considered unlikely because the dog did not have an excitable temperament. Attention-seeking behavior was ruled out because of the context specificity. A compulsive disorder, which is a repetitive behavior occurring out of context without an apparent trigger and interfering with the animal's ability to function in its social environment, was also ruled out because this behavior was context-specific and reliably elicited by the owner's departure. Separation anxiety usually manifests as vocalization, pacing, panting, or destructive behavior, but can manifest as stereotypical motor behavior. Possible differential diagnoses for scratching at the door and stereotypical motor behavior were fear and territorial responses to arousing stimuli or play behavior. The dog never had similar behavior in the owner's presence, and the behavior occurred, as is typical for separation anxiety, after the owners left, without any other apparent stimulus triggering the behavior. The dog had access to the yard when it was left alone, therefore barrier frustration was considered unlikely. A diagnosis of separation anxiety with stereotypical motor behavior as a clinical sign was made. This motor behavior may have started as displacement behavior, a normal behavior shown out of context as an animal is constrained in its attempt to perform another activity or during situations of arousal when there is no apparent outlet, no appropriate outlet for derousal. So you see what they did there, which is what you're supposed to do with behavior issues in veterinary medicine, because the animals can't talk to you. They ruled out metabolic causes. Then they ruled out obvious behavioral issues. First they also ruled out orthopedic and neurologic issues, although the owners did decline hip radiographs, but let's presume that they're normal. Then they ruled out obvious behavioral issues just based on the story and what the owners were seeing at home. And so then through that process of elimination, they came to a very specific behavior issue, a behavior diagnosis. That's how you tackle these things. You don't put these dogs on drugs immediately just because that's the easy thing to do. You have to think about it in these terms. Treatment. Behavior modification was prescribed for this dog, including maintenance of a consistent and predictable schedule, daily walks off of the property, ignoring attention-seeking behavior, and giving attention only in response to calm, relaxed behavior to encourage independence from the owners. The owner's departure from the house were counter-conditioned by giving the dog a food puzzle toy 10 minutes before it was left alone. Systemic desensitization or habituation protocol to pre-departure cues was not implemented because counter-conditioning was more feasible for the owners. They were also instructed to ignore the dog for approximately 20 minutes after returned home. A desensitization protocol to being left alone, which can be effective, was recommended but was declined by the owners. The owners were instructed to never punish the dog for destructive behavior that occurred while they were absent. Always videotape the dog at least once weekly to monitor treatment and to report signs of salivation or destructiveness. Fluoxetine, a selective serotonin reuptake inhibitor that is effective for the treatment of separation anxiety and the reduction of stereotypical motor behavior, was prescribed for this dog. Selective serotonin reuptake inhibitors, that's also SSRIs, cause downregulation of auto and postsynaptic serotonin receptors after several weeks of administration, which leads to their anxiolytic effect. Clonazepam, which is a benzodiazepine, binds to GABA A receptors, thereby causing anxiolytic effect with rapid onset of action. That drug also increases appetite, which facilitates behavior modification. Because of its longer duration of action, clonazepam was prescribed instead of alprazolam. The owners were instructed to start the lowest recommended dose and gradually increase it and watch for any adverse effects such as paradoxical excitation or ataxia. Follow-up. Because the dog had a decreased appetite and was sedate when the owners were present, by the time they started the medication, these common acute adverse side effects of SSRIs are mediated by the stimulation of postsynaptic serotonin receptors and can be resolved when downregulation of receptors occurs by reducing the dose. You can reduce the dose, you can treat a different drug, or you can administer another drug such as mirtazapine, which is a tetracyclic antidepressant with appetite-stimulating properties. However, administration of the combination of mirtazapine and fluoxetine increases the risk of serotonin syndrome. Clomipram is a tricyclic antidepressant with serotonergic and norepinergic properties, effective for the treatment of separation anxiety and stereotypical motor behavior, but it has more side effects than selective serotonin reuptake inhibitors. Therefore, paroxetine, which is a selective serotonin reuptake inhibitor with minimal appetite decreasing properties in humans, was prescribed at a low dose. Reduction of the clonazepam dose to avoid the development of tolerance was discussed with the owners. Before this could be implemented, spitting behavior recurred when the dog was alone. So they discussed with the owners the possibility of adding trazodone, which is a trizolopyridine derivative with serotonin 2A receptor antagonizing and serotonin reuptake inhibiting properties, that is, calming effects in anxiety-related disorders in dogs and sedative properties in humans. So they added that to the treatment. They wanted to add it to the treatment, but the owners declined. If treatment with a SSRI with or without augmentation is not effective in controlling signs, a change to treatment with clomipramine with its multiple pharmacological mechanisms can be considered. Treatment with colinide, which is an alpha-2 adrenoreceptor agonist, memantine, which is a N-methyl D-aspartate receptor antagonist, or a dog-appeasing pheromone, which is controversial, would also have been viable additional treatment options for the dog if spitting occurred despite treatment. Holy moly, a lot of cool stuff here. So this is how specific. This is the difference between seeing a veterinary behaviorist and going to see a dog trainer or a dog behaviorist in your area that's not a veterinarian. They, of course, have their place. I know plenty that are awesome, but you have to start somewhere, and you can either start with your dog trainer and see if they can figure it out, or not figure it out, but get your dog under control with typical behavior plans, or ideally you would get a diagnosis first like this and then probably follow up with a dog trainer if needed. So this is a pretty unique case where multiple drug options are available, all with their own modes of action and pros and cons, And so, and you can see how long this took. This probably occurred over months, if not a year's time. I didn't do the math here, but the last recheck was 9 months. Last recheck was 9 months after starting the clomipramine. So it's probably over a year-long process just to figure this out with this dog, because it takes time for these things to work. So cool case, good job. We'll see you guys in the next video. Take care.